Good afternoon and welcome to Implementing the Culturally and Linguistically Appropriate Services Standards, Recruiting, Hiring, and Retaining a Diverse Workforce. This webinar will focus on improving culturally responsive organizations and systems by addressing recruitment, hiring, and retention of a diverse workforce. Our presenters today are Selena Webster-Bass and Kathy Lazier. I am Selena Webster-Bass, a native of Jacksonville, Florida, and I've served as a health advocate for over 15 years in promoting the National Culturally and Linguistically Appropriate Services, or CLAS standards, within primary care and behavioral health settings. I've also served with the Jacksonville System of Care Initiative grant, both the implementation and expansion grant, as a cultural and linguistic competency educator, and in that role I facilitated CLC professional development, or cultural and linguistic competency professional development, organizational self-assessment, and the integration of system of care core values and wraparound care coordination. My background is public health, behavioral health, and faith-based engagement, also certified in adult and youth and mental health first aid. Currently I'm I am the CEO of the Voices Institute, and also core partner with the Technical Assistance Network for Children's Behavioral Health and the National Training and Technical Assistance Center for Children's Behavioral Health Cultural and Linguistic Competency Team. My co-presenter is Kathy Lazier. She's a faculty member at the University of South Florida, College of Behavioral and Community Sciences, and a partner with the Human Service Collaborative in Washington, D.C. Kathy Lazier is the co-director of the Cultural and Linguistic Competency Hub of the National Technical Assistance Network for Children's Behavioral Health, and serves as the co-chair of the National Work Group to address the needs of children and youth who are part of the LGBTQ+ population and their families. Kathy Lazier has co-authored numerous publications focused on cultural competence. Her commitment to understanding the strengths and challenges facing our diverse youth and families is reflected in her work in natural helpers in diverse and economically challenged communities, youth suicide prevention, and as the lead author for the U.S. adaptation of the Youth Mental Health First Aid Manual. For over 30 years, Kathy Lazier has provided technical assistance, consultation, training, and coaching to youth and family organizations, community supports and services, wraparound teams, schools, state and local territories, tribal systems of care grantees. This peer learning exchange is hosted by the University of South Florida, the Center for Community Learning, Inc., and the Voices Institute, partners in the National TA Network for Children's Behavioral Health, operated by and coordinated through the University of Maryland. These are our learning objectives for the webinar today. One is to describe the National Culturally and Linguistically Appropriate Services, or CLAS standards, that are specific to hiring, recruitment, and retention of a diverse workforce. We'll also list specific strategies to recruit and hire organizational leaders and staff that are reflective of the populations receiving services. And finally, list approaches to addressing the retention of a culturally responsive workforce and advancing health equity. Behavioral health disparities in the United States continues to affect disadvantaged populations that have historically and systematically experienced barriers to behavioral health based on youth's race and ethnicity groups, religion, socioeconomic status, gender, age, mental health, youth that are living with cognitive, sensory, or physical disabilities, sexual orientation or gender identity and expression, geographical location, or other characteristics historically linked to discrimination, oppression, and marginalization. Racially and ethnically diverse populations are more likely to receive a poor quality of behavioral health services. They are more likely to use deeper end services such as the emergency room, residential facilities to address their behavioral health needs rather than community-based services. And these deeper end services are oftentimes more costly and don't allow for the continuity of care that's needed for optimal behavioral health and well-being. There was a 2016 national study of racial and ethnic disparities in mental health care for children and young adults. And this study showed that African Americans and Hispanic children, their mental health visits were about half those of non-Hispanic whites. Also in this study, disparities were also larger for young adults than for children. African American and Hispanic children and young adults receive markedly less outpatient mental health and substance use care than their non-minority counterparts. So there are many contributing factors, individual, provider, and system level factors that contribute to behavioral health inequities. For example, cultural values. Racially and ethnically diverse communities may prefer to rely on informal sources of counseling, such as family members, friends, or their faith communities, such as clergy, ministers, or curanderos, because of trusted relationships and minimal cost. Another contributing factor to behavioral health inequities are social determinants, such as environmental factors. For example, if youth are living in communities of violence and experiencing community trauma, they are at an increased risk for poor mental health outcomes. Provider barriers. Providers may not understand the multicultural needs or context of diverse populations and lack consideration and respect for youth and families' cultural beliefs. Structural barriers. Shortage of child psychiatrists and living in mental health professional shortage areas in rural and urban communities may hinder access to behavioral health services. And the final example, which is our focus today, is the lack of racially and ethnically diverse leadership and staff. That is the incompatibility between the organizational leadership and staff and youth and families receiving services may also contribute to inadequate care, not understanding the cultural health beliefs, language access needs, and the social and cultural context of the populations of focus. This slide lists strategies in addressing behavioral health inequity. The first strategy is the application of the National Culturally and Linguistically Appropriate Services, or CLAS standards. The use of care managers, such as wraparound coordinators, peer support partners to assist with youth and family engagement. Another example is the use of telemedicine to increase access and the availability of behavioral health services in rural and urban communities. The use of data, agencies monitoring behavioral health utilization patterns and behavioral health outcomes based on cultural characteristics, and using that data to adapt services. And then finally, building a diverse and culturally responsive workforce. I'd like to show you a video that was developed by Youth and Families with the One Community Partnership 2. The One Community Partnership 2 is a grant and county initiative enhancing delivery of services to transition-age youth and emerging adults with mental health challenges in South Florida. This video was scripted and acted in video skits based on real-life experiences that highlight the application of the national CLAS standards. So the video is a little humorous, but I think it gets our point across in terms of ensuring that we are addressing the needs of multicultural populations. While watching the video, I'd like for you to share your responses to the organizational leaders' interview skills in the chat box. So if you could just watch the video and share your responses in the chat box, and then we'll debrief after the video. Barry, will you provide us some instructions? Thank you.
Certainly. Okay, so in order to hear the audio for the video, we need you to, if you dialed in, and there's about 4 folks that I see that dialed in for the audio, you're going to do one of 2 things. If you have your phone on speakerphone, go ahead and take it off speakerphone for the video, or set down your handset away from your computer, and then you're going to unmute your computer speakers, and we'll give you a couple of seconds to go ahead and do that while we get things queued up. All right, so we'll go ahead and we'll get the video started now.
Mr. Richard, yes, Mia Moore is here for your interview. Okay, I will. Mia Moore, Mr. Richard is ready to see you.
Thank you.
You're welcome, ma'am.
Hello, I'm Richard, and you are?
Buenos Aires, Mr. Richard. My name is Mia.
Have a seat.
Thank you. Thank you very much for this opportunity. I really would like to tell you about how I qualify for this position.
And what makes you think you're cut out for this job?
I'm so glad you asked. Here's my resume. It shows how I meet every requirement asked for this job. I'm also Hispanic, and I know you serve the Hispanic community, especially women.
Ah, you're Hispanic?
Yes.
We'll probably need to do an evaluation to verify.
An evaluation? Is there a problem?
No, it's fine. We'll be in touch. Thank you.
Okay, thank you.
Sir? Sir? Sir?
Yeah,
He's ready to see you now.
okay.
A nice script there, son.
Thank
Are you Luke?
Yes, I am. And when can I start?
We'll have to ask you a couple of questions first.
Okay.
Well, I do have a couple of questions for you.
I mean, shoot.
Do you have a resume?
No, but I mean, you could always ask me about my last job.
Okay, that's there. So you have done some previous work related to this job?
I mean, a little something here, something there, you know.
Okay, that's good. So you do have a little experience. Do you speak any other language?
No, I live in America. I speak American.
Okay, that's fine. You are all right, Luke. We are in America.
Mm-hmm.
I'm not sure you have all the requirements for this job, but it looks like you have some of the skills we need.
Okay. Yeah?
So you should be okay.
Okay, cool.
I'll call you personally and let you know when you start.
Awesome. Thanks, boss man.
Have a fantastic day,
You
Luke.
too, thanks.
As a service provider, you are entrusted to provide equitable care that is
Okay, for those folks that
responsive to diverse cultural needs, including health beliefs.
again, and
Being
if you
culturally
want
competent
the rest of the
means that
webinar
service provider
through your phone lines.
So there's one comment from Debbie Hart, what an evaluation. So any other comments on the video? You have a few other people typing. So you can see in the video that the interviewer made some assumptions, one about race and ethnicity, by just looking at more of the character there. And so there was some implicit bias, some assumptions and generalizations and mental models about race and ethnicity. He identified her as probably African American, which we know there are laws, Title VII Civil Rights Act, which prohibits discrimination based on race and religion, sex, and national origin. But he identified her as African American when she identified herself as Hispanic, and she was also bilingual. So he made an hiring decision based on what was familiar to him with the second guy, or most comfortable for him, rather than thinking about the populations of focus. He didn't ask anything about experiences with working with the multicultural populations, or experiences with working with their populations of focus. So this is just an example of how oftentimes our bias can influence the way that we make decisions within organizations. I'll turn it over to Kathy.
Okay, thank you, Selena. So what I'm going to just take a few minutes, because probably many of you have been introduced or have already probably even been integrating the culturally and linguistically appropriate service, or the CLAS standards, into some of the work that you're doing. But we did want to just provide a quick review for you, for those of you, so that we're all working off the same page. The CLAS standards, what are they? So they are really aimed to improve quality of care and increase health equity. And they're really intended to provide a reference and a framework for the recommended practices for appropriate service delivery. And one of the things that we've done through the TA network is really use the CLAS standards as exactly that, a framework to provide a lot of the technical assistance that we do. So the CLAS standards are they're a starting point for an organization. When you're looking to first, how do we tackle, or how do we begin to create work plans for, to address cultural and linguistic competence and to address any of the disparities and disproportionalities that we see. They're also a mandate for behavioral health and other service organizations, other health organizations, and it's a guideline set in place by the federal government. When you examine the standards more closely, there are three types of standards. Of varying stringencies. There's mandates, guidelines, and recommendations. So the CLAS mandates, are current federal requirements for all recipients of federal funds. There's guidelines, which are activities that are recommended by the Office of Minority Health for adoption as mandates, by federal, state, and national accrediting agencies. And then there are CLAS recommendations, which are suggestions by the Office of Minority Health, and they're for voluntary adoption by healthcare organizations. And the standards that we're dealing with in this presentation have to do with language assistance, and they are not recommendations, but they are mandates, since they describe and implement requirements from the Civil Rights Act of 1964. Let me go to this next slide. The original CLAS standards were published in 2000. And then they were updated in 2013 by the U.S. Department of Health and Human Services, the Office of Minority Health. And the key intentions are to advance health equity, to improve quality, and to help eliminate health disparities. And again, the CLAS standards are a blueprint for sustaining CLC practice and policies. The 2000 Enhanced 15 standards expanded the definition of culture, and it broadened the understanding of health, and it includes behavioral health and primary care organizational focus. It emphasizes the need to provide continued training to primary care and behavioral health organizations. Health organizations are beginning to incorporate this type of education and training into their policy statements. And in addition, many states are beginning to mandate cultural competency training for healthcare professionals into legislation. And the Office of Minority Health did a survey, did a scan of, and put together a compendium of state-sponsored CLAS standard implementation activities. And you can actually, look at this document from the Office of Minority Health, and You can see states such as Maryland, they've incorporated the national class standards in several of its policies and plans. California has a number of the states. What they've done is they really use them and they build them when they put together their cultural competence strategic planning, statewide strategic planning. So the national class standards aim to help mental health agencies and other health and healthcare organizations to incorporate many of the elements considered critical to delivering culturally and linguistically appropriate practices. When we talk about mandates, CLAS is strongly linked. There's an inseparable bond to Title VI of the Civil Rights Act that Selena had mentioned earlier. The Civil Rights Act of 1964. And it was a historic law that was initiated by President John Kennedy, signed by President Lyndon Johnson back in 1964, and it was a product of this growing demand in the early 1960s for the federal government to launch this nationwide offensive against racial discrimination. So, it covers some of the main agencies that it covers are hospitals and health clinics, Medicaid and Medicare agencies, alcohol and drug treatment centers, extended care facilities, public assistance programs, nursing homes, adoption agencies, daycare, mental health, and even the senior citizen centers. So you can see how expansive it is. I'm losing my slides. So the principal CLAS standard is to provide as effective, equitable, understandable, respectful quality care services that are responsive to diverse cultural health beliefs and practices. Talks about preferred languages, health literacy, and other communication needs. The principal standard is the outcome, and it's the foundation for all other standards. It's kind of the final destination. So when we looked at how it's divided up, governance, leadership, workforce development, communication and language assistance with language access plans, health literacy, teach-back methods, cultural assessments, and then also that CQI, or continuous quality improvement process, and accountability that looks at satisfaction, engagement, the regulatory and legal requirements. So this particular webinar addresses CLAS Standards 2 to 4, which is related to governance, leadership, and workforce, and recruitment and hiring. So we're going to be looking at a couple of things. We're going to be showing you a couple of items later on in the presentation. I just had to go forward a little bit, but I'm going to go ahead and turn it back to Selena to get into some more detail around the CLAS standards, the particular things we'll be talking about.
Thank you, Kathy. So our behavioral health systems, we need culturally and linguistically competent providers that can authentically honor and respect the cultural beliefs of youth and families and bridge the gap between quality, equitable services, and diverse populations. We need providers that are culturally self-aware, that are aware of their implicit biases and how to manage those biases, and also that are effective in cross-cultural communication. And we need providers that understand the cultural and language access needs of families in delivering quality, understandable, equitable, and effective behavioral health services. There is an underrepresentation of diverse behavioral health providers in our system. For instance, African Americans make up nearly 13% of the U.S. population, but they comprise only 3.1% of psychiatrists and 2.1% of psychologists. Also, Hispanics comprise 16% of the U.S. population currently and constitute 4.3% of psychiatrists and 2% of psychologists. This underrepresentation and diversity in behavioral health professionals must be addressed by provider networks forming partnerships with high schools and behavioral health programs at colleges and universities and academic institutions, including tribal, Hispanic, and historically Black college and university institutions to bridge the gap between diverse populations and behavioral health providers. System of care communities may also diversify their teams by hiring wraparound coordinators and peer support partners and cultural brokers that are knowledgeable of multicultural communities. So why is a diverse workforce important? Organizational leaders should emphasize the benefits of recruiting, hiring, and retaining diverse governance members, leaders, and behavioral health professionals and paraprofessionals that are aware and knowledgeable and have skills in working effectively with marginalized populations. One of the benefits of a diverse workforce is the impact of cultural matching of providers with youth and families, which leads to increased engagement, trust, and rapport and alliance building with providers. A diverse workforce also increases the quality of mental health services by recognizing the inherent diversity of the human experience. Organizational leaders should also promote the training and research that is relevant to multicultural children, youth, and families. There are several studies that confirm that diversity produces enhanced understanding within organizations, that diversity translates into the ability to adapt services to meet the needs of diverse populations, and that diversity unlocks innovation. Organizational leaders should embrace diversity and inclusion by creating work environments that ensure diverse voices are valued and heard, and by making it safe to propose novel ideas. Here are a few tips for hiring a diverse workforce. We all know that if it's not written down in our organizations, it's not going to happen. So including hiring of a diverse workforce in our organizational strategic plans and policies is essential. Using a long-term approach with external stakeholders by forming academic partnerships to build workforce capacity to recruit diverse providers and staff is also needed. And also forming networks with various professional organizations such as the Rural Health Network, the Association of Black Psychologists, for example, LGBTQ networks, the National Latino Behavioral Health Association. All of these are networks that where partnerships can be formed to build the capacity of the workforce to address the needs of multicultural populations. A third tip is to create wide and diverse interview pools by using multicultural job search engines, job boards, and again, partnering with multicultural professional organizations in advertising vacancies. So some examples of multicultural job search engines include employdiversity.com, diversity.com, multiculturaljobs.com, and other resources of the like. Including cultural and linguistic competence-related questions in the interview pool. You want to ask your potential hires about their experiences working with diverse populations, their knowledge of multicultural community resources, and how they've even resolved conflict when there's cross-cultural situations that may have arisen in the past. So, as we saw in the video, the interviewer did not address any of those type questions. He was more focused on other factors. Also increasing the number of individuals hired as behavioral health peer providers in primary care and behavioral health organizations. And then finally, providing CLAS standards and other CLC training to new hires. And so, cultural competency training should not just be a once-a-year event, but should be ongoing and integrated throughout the levels of the organization at the provider, management, and also resource allocation throughout all levels of the organization in terms of meeting the needs of multicultural groups. Kathy, I'll turn it over to you.
Yes, thank you, Selena. Thank you. So, when you look at those tips for hiring a diverse workforce, some of the things questions you might ask are, well, how exactly do we do that, and what might that look like in both, hiring people for those kinds of positions, and also what might it look like in the CLC plan. And I think this is a true statement when I say that many, if not the majority of questions that we get often around CLC in this particular topic area is, what does a sample coordinator job CLC coordinator job description look like, and also what does it look like when you are writing something, and trying to get hiring a diverse workforce into a CLC plan. So I'm happy that Catalina Booth was able to join us. She is the director of the Center for Community Learning and is provided for us a couple of examples of both the CLC plan and the sample CLC coordinator job description. So I'm going to go ahead and turn it over to Catalina.
Thank you, Kathy, and I'm glad I could jump on. I wanted to share with you two tools that will help you actually put this into place. The first place to start with is to make sure that your CLC plan reflects your goal of hiring and retaining, developing, and retaining a diverse workforce. We have in previous versions, in previous editions of this CLAS implementation series, provided sample CLC plans. So we're not going to look at the entire one, just a section of it. But if you do need a CLC plan, what we'll do is when we send up the wrap-up email, we'll send the entirety of the CLC plan that you're going to look at here, because you're only going to be able to look at snapshots of it. So this is the part of the CLC plan that would discuss hiring and recruiting a workforce. On the left is the column that the way this organization structured its CLC policy is its goal. It just rewrote the CLAS standard. So each CLAS standard, they had 15 goals, and each one of them was one of the 15 CLAS standards. And so under recruiting, promoting, and supporting a culturally and linguistically diverse governance leadership workforce that's responsive to the population in the service areas, they had their, right after their goal, the next column is their objectives. So those are more targeted objectives based on the CLAS standards. And their goals were to create an environment in which culturally diverse individuals feel welcome, to promote trust and engagement, and to infuse multicultural perspectives, to ensure a diverse viewpoints are representative in governance decisions, and to increase knowledge and experience related to culture. So a lot of organizations, well-intended, they'll have the goal of a CLAS standard or something that fits the CLAS standards, and then they'll write an objective, but then they stop there without writing clear action steps or tasks. This organization went the step of creating specific action steps for each goal and each objective. And that's what you see in the middle column. It actually describes who's in charge, in this case the program director and the HR director. It states exactly what it talks about advertising opportunities in targeted foreign language and minority health professional association job boards. So it's exactly putting into place what Selena talked about earlier and putting that as a task. And making very clear plans. So those are some examples of the steps of the task action plan you can form. The next two columns talk about where, how these are implemented and at what stage they're at. The last column is, I'm sorry it cut it off, but the last column is basically what they call the data source. And the reason that column is in there is when you go to evaluate our program, this is where you can figure out if we've achieved our goals and our objectives. You can go to our job postings, our emails, our social media postings. You can look at our meeting minutes, sign-in, and sheets. So they're committing themselves to showing in those documents that how they're achieving and how they're putting into play their cultural and linguistic competence plan, specifically as it deals with a diverse workforce. And the other important area is that you don't just want to hire and retain, you want to retain and develop a diverse workforce. And how do you do that? You do that through education and training. So under the CLAS standard that talks about education, training, and governance, leadership from workforce, this organization, and we recommend you do something similar, has objectives and action items that directly relate to education. And realize, one thing that's interesting and one thing that we highly encourage is that class standard implementation and CLC training not be a one-time shot when the person is hired or even once a year, but something that is infused throughout all portions of training and education. And that's how they set up their accountability. Notice they say at monthly and weekly staff meetings and group supervision, they're going to discuss matters of CLC education and training and engagement. They will provide staff they will actually hold themselves accountable by having attendance sheets and other records of participation. So once again, I'll reiterate the point that having the goal of educating and providing culturally and linguistically diverse education and training is fabulous, but you got to put some meat, some ammunition in that one, and through action steps and ways to show that that's actually occurring and weave it throughout the organization. And the last tool we were going to look at is one that you can download. On the middle column under the public chat, you'll see a CLC coordinator. You can download the sample CLC plan yourself right now. It just doesn't show well over the screen, but you can download it and print it, and it'll show you the entire CLC plan for this organization that we're looking at. And then if you look in the middle, there's a CLC coordinator document that you can download. Gary, can you put that up quickly for us so we can take a quick look at it? And this is a sample, and it's a draft form. We're still tweaking it a little bit, but it was adapted by a document that Ken Martinez created back in 2008 called the Sample Cultural and Linguistic Competency Coordinator Job Description. And it's been updated with more current CLC standards based on the CLAS standards and a more inclusive definition of culture and a more inclusive definition of what the CLC coordinator will do. The first part of it, it's important that you give your new CLC coordinator, whether it's a full-time position or a part-time position, or some groups are doing in some new sites. I've seen the social marketing person is also doing the CLC coordinator. You just want to make sure you have clearly established responsibilities, not just in generic terms. And that's why in this one we talk about duties and responsibilities, about including creating a CLC team to assist that includes family, youth, and children. The CLC coordinator being a resource for the entire system of care on cultural and linguistic competence. And number 3 would be providing support to a cultural and linguistic competence committee. While the CLC coordinator, the best way to think about him is as a coordinator and a facilitator, but really the people that are going to do the meat of it, you want it to come from your CLC committee, and you want your CLC committee not to be made up of administrators only or staff members only. That really should be a consumer-based and a consumer-driven and a consumer-led group. And what I mean by that is you should have family, youth, and children and young adults that you're serving on that committee, creating the goals and creating the vision for applying the CLAS standards and cultural and linguistic competence. I'm not sure if we have anybody from Broward County OCP2, but I'm going to use them as an example. They have a CLC committee, and their CLC committee had as its goals to find new ways of implementing the CLAS standards and letting participants and consumers understand the CLAS standards. So they designed a series of videos, and you just probably saw one of them. That's an example of how the CLC coordinator serves as a facilitator and helps gather services for that organization. So this is a sample you can use and adjust for your needs. I think in future updates we'll probably specifically relate and include knowledge of the CLAS standards, or at least willingness to
to study the CLAS standards, because that's a really important focus and shape, obviously, as we focus on this one. We can switch back to the regular presentation, Gary. And Selena, I'll turn it back over to you for retention of a diverse workforce.
Okay, thank you, Catalina. So as Catalina just spoke about, it's important to have actual documented goals and objectives specific to not only recruitment and hiring, but also the retention of a diverse workforce as well. So here are a few retention strategies. One, you want to monitor your diversity and inclusion recruitment and hiring goals. You know, in your strategic plans, you want to make sure that it's not just something that's written down, but something that you're actually going back to and looking at your numbers and looking at your population for focus and your demographics to make sure that there's compatibility and congruency between your organizational leadership staff composition and the families and youth that are being served. You also want to use performance appraisals as an opportunity to evaluate culturally responsive attitudes, knowledge, and skills. This is a way to build employee confidence, and also it's a way for supervisors to work with staff in setting goals and also providing incentives and rewards. And so during performance appraisals, employees may ask questions about attending cultural and linguistic competency continuing education programs, or even have the employee engage multicultural partners or cultural brokers and resources to reduce barriers to care for youth and families. Also, training is really critical in terms of retention of a diverse workforce. I suggest that you really should start with a training assessment to determine what the training needs are of your staff, and from that training assessment, prioritize topics that should be included in your training plan. So you create your training plan, you develop your curriculum or use existing curriculum, and this curriculum should not just address cultural awareness, but also the development of actual skills and cultural competency, cross-cultural communication, resolving conflict, and also the acquisition of cultural knowledge of discrimination and harassment policies, and also knowledge of multicultural groups and their cultural health beliefs. The next step is providing culturally responsive clinical supervision and coaching to enhance culturally competent behaviors among behavioral health professionals. You want to include CLC on your management and team agendas, maybe even discuss specific cases that highlight families' cultural strengths and challenges. And then the final strategy is using exit interviews as a valuable source of information to improve workforce development. Are there any internal issues that may need to be addressed in terms of staff and management relations? This is an example of standards of cultural competency for, these are from Wraparound Milwaukee. This is actually a cultural competency policy and what's expected of their staff in terms of awareness, knowledge, and there's another document that includes skills, and we also have that document available to download. So you can see here with the awareness, cultural self-awareness is addressed, sensitivity is addressed, the appreciation of cultural differences is here, and also positive emotional reactions. In terms of knowledge, understanding, first of all, one's own cultural background, because that's the first step in becoming culturally competent, is understanding one's own cultural self-awareness, and then also about the cultural and racial and ethnic background of the families that are being served. And then in the final paragraph here, we see that culturally skilled service providers seek out educational and training experiences to improve their understanding and effectiveness in working with culturally diverse populations. So again, this goes back to the importance of training and professional learning and forming learning collaboratives and having those ongoing conversations about cultural competencies, whether it's through cases or whether it's through staff relations in terms of in terms of addressing the needs of multicultural groups. All right. So are there any questions from our participants around hiring and recruiting and retention of a diverse workforce? All right, Kathy and Catalina, did you have anything you'd like to add?
No, I think you covered it very well.
Yeah, and I see that Michelle and Chandra, a couple of other people are typing, and while they're typing, I just wanted to say that we are looking for putting together a kind of a compendium of ways that people are paying for interpreter services or having a translator in their organization, having somebody come to translate in their organization, or translating documents or an interpreter. So if any of you have particular ways that your organization is paying for that service, we'd really like to hear from you, because we'd like to put together a compendium of how system of care sites and other organizations are doing that.
Are there other tips or other strategies that you all have used in your communities that may be helpful to the group today that you'd like to share? See that we have several people typing. Okay, we have a message from Chandra. She said that the CLC job description was really helpful.
And I had thought in my brain that I had added the class standards, so I'm going to update it. And when Gary sends me the wrap-up email, I'm going to have him send you the version 2 with the class standards directly mentioned, so everyone has that, okay?
So we have a comment from Michelle that often agencies participate in online culturally competent trainings, but they are hardly implemented or practiced. How can we help them implement? I would say part of that is having the CLC plan, so actually having action steps in terms of ways to address cultural competency within the organizations, and using the class standards as a guide in developing that CLC plan. And having some type of accountability group, such as a CLC committee or governance structure that's reviewing and monitoring the plan to ensure that there is actual implementation and execution of those action steps. So having it written down and coming up with plans across those 3 domains that we mentioned earlier, the domains of leadership, governance, language assistance and communication, and then the final category, continuous quality improvement, developing those action steps are important. Okay, Chandra is sharing that her organization requires CLC plans to receive funding, and they have clear action steps, which helps with accountability, and they're required to report twice per year. Thanks for sharing that, Chandra. And Michelle says she agrees. Okay, great. I have one more comment here.
One thing regarding the CLC trainings, an innovative way that I've seen that handled, because I know that sometimes when funding is an issue, I know that the Texas System of Care, their CLC person, their CLC coordinator, does regular webcasts, both podcasts and webinars with additional training. They have a hybrid model. They require 1.5-hour online training for CLAS standards and CLC, and then they supplement it on a regular basis with podcasts on topics and themes that have arisen, as well as webinars. So that's just another way of doing that when you come from when you're a statewide system of care. That's one way to filter it down. And obviously at the organizational level, you're going to want to do in-person training.
Mm-hmm. And a couple of other strategies that we felt to mention was making sure that when you are interviewing that you really have a diverse interview group, because you want those multiple perspectives, you want several lenses, that are part of the process, and another area is de-identifying resumes, because oftentimes people are weeded out just based on ethnic sounding names. And also based on age, looking at graduation dates. So it's best to de-identify your resumes so that it's a fair and unbiased process. So a couple other tips that we left off. Michelle is responding to Kathy's request for strategies for language access. Michelle says, I've utilized language support from our local university that specializes in deaf and hard of hearing, hospitals, language services, and the DC Department of Behavioral Health have a service that you can access on a telephone to help people whose language requires interpretation and translation. Thank you, Michelle. Know that some communities are also working with ethnic community-based organizations and hiring peer support educators that are bilingual to cut down on costs as well, because for many agencies it is very expensive for interpretation services. And so one way to address that is by employing cultural brokers who are also certified bilingual interpreters. Any other comments from the presenters?
No, I think we've covered it all.
Yep, thank you. Well, we'd like to thank everyone for participating on our webinar today. We look forward to your participation on our next webinar. Check out the TA telegram for our next date and time. And thank you. And